is a skin wound care product. He's going to talk to you about, he'll explain to you where the product started and all of that information. So welcome. This part of your service.
Great. Hi. Well, good afternoon, everyone. My name is Brian Moore, and I'm with Kerecis. So, have any of you heard of Kerecis before? First time experiencing it, hearing about it?
Mm-hmm.
Okay. And just get a sort of a share of audience. What's the backgrounds here typically? We have techs.
I'd say you're about 99% techs here today.
Techs. Okay. Great. Wonderful, wonderful. Well, thank you for having me. I'm out of Miami, Florida, and I cover South Florida. And I represent a company called Kerecis, which is cod fish skin. We're the hottest, latest, greatest technology right now that we're putting on patients all over and healing wounds and deficits. And so today I'm just going to present with you very high level about our background, the product itself, how to apply it, the different specialties that are involved, and then show you some pictures. I'll keep it very high level, not to get too detailed in the weeds, and then open it up to some questions. Okay?
Sounds good.
All right.
Yeah.
So let's begin. Kerecis. Kerecis, on the first slide, thank you. On Kerecis. So Kerecis is based out of Iceland. We're an Icelandic company. And this is called Ísafjörður, Iceland. So this is where all the magic actually happens. And this is on the cold waters in the Atlantic. A little bit north here is in Greenland, Iceland, Greenland. So Iceland is where we have all of our productions and where we bring in, the cod fish, and so it's actually a byproduct of of Iceland, and so we end up taking the underbelly of the skins, and we end up having the processing pieces that put together, and then we ship them off here all over, and we're expanding like crazy. But the cod fish skin are the ones that swim here in the Atlantic, and then again we just cut the underbelly, and we have these skins here, which I'll be getting into very soon. So next slide. Okay, so Kerecis. The cod fish skin, we are actually FDA 510K approved, the only fish skin on the market that is 510K FDA approved from head to toe, and we're actually implantable. So we are covering, any kind of the traumas that occur. We're diabetic foot ulcers and venous leg ulcers. We're also covering it for burns. So we're anything and everything that might need some tissue regenerative product to help with the healing, or to create any kind of the deficits or crevices that might be happening with traumatic issues that happen with patients. So, next slide. Okay, this is sort of Kerecis' wheel of innovation. So we have a variety of different types of markets. So we have our yellow area here, which is our Merigen product line. This is covering basically our office wounds, and we have it segmented now where we have Merigen that's covered strictly in the office or in the wound care center. We have a wide variety of different sizes. Then we have our Graft Guide. Graft Guide is going to be more focused towards our burn specialties, and then our surgical trauma wounds is called our surgical Surgiclos. And so with our different type of product configurations, we have a solid sheet, which is like this, of a variety of different sizes. We also have a particulate, which is pulverized fish skin, and this is going to be used for any kind of deficits, uneven terrain area for like amputations or whatnot. We'll go ahead and pack this in if there's any kind of tunneling. Well, any of that sort, we have this micro, which is pulverized fish skin. We also have a meshed product, so this particular piece is a solid. Our mesh piece comes in a solid, so that's another unique feature, is that our products are also pre-meshed. So just to show you real quick, when I go ahead and wet this is what activates the actual fish skin for up to 30 seconds to a minute. We end up dousing it in water, saline room temperature, and then 30 seconds up to a minute, and then you'll be able to see what this can really do here. And then just go back here. can see
Wow.
it's meshed. It's a real wow factor. So you don't need the dermatomes or anything like that in the office, okay? So this cod fish skin, we don't have any contraindications except if you have a fish allergy, not to be associated with shellfish, okay? So really cool. The mesh product is there to expand to have greater coverage as well, okay? So I'll go ahead and pass this around if you'd like to touch it and feel it and see it. So it might help you down the road if you want to swim faster or and then our other piece is a fenestrated piece. And the fenestrated piece is again another solid piece, but it has little slits in it, and that's for whenever we end up having it implanted into a patient and we want to use a wound vac. So the wound vac is where it's pulling and pushing a lot of the liquids through our fenestrated areas here, so it allows that fluid to pass through. So we have the fenestrated. So those are the 4 different product configurations that we have. So real quick, any questions at this point? Yes, ma'am.
So you could use these on like unstaged wounds, like really, really deep wounds?
Yes,
Wow.
correct.
Is there like a breaking point for like stretching or whatnot when you're not?
No, with these particular products, it's a 2-to-1, and again, our material is so thick, which is really nice, and a lot of the surgeons love about it because we can staple it, we can suture it, also just steri-strip, and then we put an adaptic over it. But the expansion, we have 300 square centimeters meshed that go up to about 500, 450 square centimeters. And we have all the way down to a product that would be like a solid of a 1.75 by 1.75. So a real vast difference in sizes. But for the coverage aspect, I've done a burn patient where we used 3 of the 250 square centimeters and covered the entire back. And the nice thing is you can cut this to manipulate and just strategically place the different fish skins to fit the anatomical structure that you're trying to achieve for healing. Yes.
Or you could use it for something like a pressure ulcer, where it had like tunneled. I had seen a pressure ulcer where it had actually tunneled almost to the spine. Would you like use that material and almost pack the pressure ulcer?
Yeah, so what we've done also in certain circumstances where we'll have, and it's a good question, we'll use some of this micro to use some for the packing aspect of it, but you can also use it for a solid piece that we can put in that's little fenestrated areas that allows for some of the fluid to come through it. But what we have is some physicians will actually use our pulverized fish skin to uneven the different deficits, and then we'll apply a solid piece on top of that. So we have the pulverized fish skin, and we have a solid piece, and we call that a fish sandwich.
So
No,
you
you.
can use the multiple different types together.
That's correct.
Okay,
Yep, if need be, and some physicians do that.
excellent.
Is it the thickest on the market? Because that's pretty thick.
It is very thick. Again, when we place this cod fish skin into the patient, depending on the anatomical structure, it'll automatically incorporate. It is not being removed later. So the incorporation will usually last in the first 24, 48, 72 hours of beginning to incorporate, and it usually fully incorporates within about 7 to 10 days. Full incorporation. Yes, ma'am.
Aside from an allergy, what are the chances of rejection?
You know, the only thing is we don't promote the product if it's infected. That's a big piece.
Okay.
But, I mean, we're growing this on tendon, on bone, so we're really making a lot of headway. But if it's an infected wound, we tend not to place our product on that.
Okay.
Yeah.
That, her question makes me circle back to like the wound vac. You know, those are highly difficult areas to take care of and obviously fix and bring back to their original state. Infection is constantly something you have to battle. So what would you do? You know?
Yeah, so with our particular product, because it's a fish product, what does it have? Omega-3s. And so we create an antimicrobial barrier.
That's nice.
So when we apply this fish skin, we have this antimicrobial barrier that prevents any chances of this infection. And we have, I've got another slide here that talks about the healing properties and the amount of time for preventing any kind of staphylococcus to be incorporated on that.
So I'm just thinking about like, you know, like bed sores, and when they get really, really deeply on stage, that's tough trying to fix that, and I can only imagine how much, I mean, that's great, that's awesome. I
Yeah.
wish those would have been around a long time ago.
Yeah, and especially even for, you know, when you have a lot of the total knees or hips or something like that, and you have the inflammation. So we have that inflammatory stage that we help with at 96 hours, and then it dramatically decreases to help with that wound. So it's a positive trait with the omega-3s that are stacked. Any other
What
questions?
should I do with this?
Yes, I'll take it.
Is that all fish, or is there anything else added to it? Fish skin? It's
No,
just
this is just strictly codfish skin from the underbelly. That's it. So it's the epidermis and the dermis.
How do you sterilize the fish?
What's that?
How do you, like, sterilize the fish to
Yeah.
get that off of it?
Yes. So with our,
Slippery.
yeah, our, that's the nice thing with our products is because it's in the cold waters of the Atlantic, we don't have the harsh processing. We don't have the detergents, and we don't have these other harsh pieces that, and the bleaching that really hinders the proteins, which I'll get into in a little bit. So therefore, we're able to maintain a lot of the key purities of our skin grafts to have it allowed to incorporate very quickly. But yeah, it's a great thing. So
It's like $1 million idea.
I'm sorry.
It's like $1 million idea, that's awesome.
Yeah. Yeah. Okay.
Yeah, multi-million-dollar.
Moving on to the next one. Thank you. So this is sort of the patent environmental intact processing. This is where we just get into the sort of lifeline of us, of Kerecis. You know, it's homologous to human skin, which I'll get into in a little bit. And again, what we're really after is like with like. You know, that's really what we're trying to achieve here, is having like with like to have that incorporation where we're applying this product on humans. There's no risk of viral disease transfer. And the reason behind that is, again,
Yes.
our cod fish skins are swimming in the cold waters. So you don't have, unlike the Zika, or you have tilapia that's in the warm-blooded, that you have to constantly do the bleaching to eliminate any potential risks. We don't have that because of the cold waters that these codfish swim in. The gentle processing, again, we don't have the strong alcohols, the detergents, you know, the cross-linking, there's no chemical cross-linking. It's a byproduct of the Iceland fisheries. It's very cost-effective because we don't have to go through these multiple stages as 70 to 100 other different companies do. So with us, it's very simple that we're able to have the minimal processing, and therefore we can ship it right out because we don't have the multiple steps of the bleaching and the stripping and all that hinders the proteins.
So since this is a byproduct, the fish are already, they're grown in Iceland, and then they're used for food resources then afterwards.
Okay.
Yeah, it really started years ago when, because we've been around now for a few years, but our CEO is obviously from Iceland and worked in the fishing industry, and so therefore they were throwing a lot of these skins away. And so through further development, he was able to really look into this and was able to find that we really did have something here with some healing properties. And so that's where we really took this a step further and really enhanced it to find out that we did have really something here that was really a wow factor and very different in multiple levels. So also with our particular product, because of the structure, the biology, we have also it recruits the host cells. So when we incorporate our fish skin into the human skin, it recruits its body's own cells. So we're able to maintain your own pigmentation. We're able to regrow the hair. So those are a lot of unique type properties here. Okay, next slide. Thank you. So this is sort of a comparison of Kerecis to our competitors. And we have it broken down by product categories. So you have the preserved molecular content, the intact organization of the molecules, the skin-like natural mechanical properties, and their structure, and then some of these that causes a second wound. So you have some of these different types of products that are out there on the market, and then you have comparable to Kerecis. And so this just gives sort of a snapshot that we're able to maintain a lot of these key elements, and on top of that, you know, we don't have to worry about having to cause a second wound, because the standard of having any kind of a tissue is what? Split thickness?
Mhm.
That's sort of the golden standard, right? So with ours, we're able to use this fish skin where we don't need to have split thickness as a second source with creating another wound.
So is codfish the only fish that is able to do that, or?
You know, I'm not sure about that. I believe though we are, but again, I mean, there's tilapia on the market, shark is from Integra. But again, that's what we're claiming, because that's what we found in our studies, that's what we able to do.
And it's literally just fish skin, like
Cod.
straight up cod.
Cod
fish skin.
fish skin.
Well, I used to see the tilapia back in like 2005. That was in Brazil. They were doing the tilapia skin. So, but I guess obviously it's the same premise, right? Yeah.
Yeah, but again, tilapia is the warm-blooded, not the
Correct.
cold.
Raw. Yeah. That's exactly.
Yeah, excellent. Okay, so again, the whole preface which I was starting off with earlier is that we want to achieve like with like. So this particular slide really demonstrates the similarities when I say that it's very homologous to human, is that I'm talking about the structure in itself. So it's like, it's structures that are very similar with like structures. So this is the fish skin, this is the human skin. So you can see how very similar they are, and we're able to have our epidermis and the dermis in these skins. Next slide. So this is our 3D structure here. So this is how our whole magic works, if you will, is it's our fibroblast. So our fibroblasts are 10 times the size in the porosity compared to an amnion or chorion, as you can see here. And so that fibroblast and how we're able to incorporate much more quicker is because of the size of our fibroblast, or the pore size of the fibroblast, which is a really big differentiator. Okay, next slide. So our natural mechanical properties. So we do have products, again, I know I reiterated, but I wanted to share that with these particular skins that we have. They can be meshed, obviously stapled, we can have them sutured in as well, and they're robust. And so we also have that elasticity. So you know, on some burn patients, if you're aware or not aware, that when they end up applying it onto the actual skin, that you'll have that elasticity, whereas with some of the other companies you don't. Next slide. So this is the key, like one of the biggest key differentiators for us, is that we're able to maintain a lot of our key proteins that I spoke earlier, because we don't have the detergents and the bleaching and all those other pieces to it. We're able to maintain a lot of our key proteins to have that incorporation, and on top of it, it's stacked with our omega-3s. Next slide. So the natural molecular organization, this is the fish skin, this is the human skin, you have the porcine, the amniochorion, and then the small intestinal mucosa. So this just shows sort of the different structures of some of the competitors that, you know, that we're up against aside from the human skin. Next slide. So this particular slide here is basically a summary of the 4 hallmarks that we're talking about, that has that 3D dimensional organization that incorporates all these 4 pieces that we discussed. And it has the fibroblasts in the red area, and then you have the Kerecis, so it's meshing together, it's starting to form that epithelialization, which is really important. So, And this just shows, you know, the fibroblasts, the recognition, the migration, the proliferation within Kerecis and how it works. Okay? We'll move in. I'm going to skip some slides here so I don't get too heavy in the weeds. But this particular slide here, the wound healing cascade, so you have the hemostasis, the inflammatory stage, you have the proliferative stage, and then you have the remodeling and the maturation stage here. And those are the 4 hallmarks here for the whole wound healing cascade. So next slide. These are, again, some of the studies that we've done against some of our competitors. We'll just slide through, we'll go through some of these. Keep going. So this is the remodeling that I was talking about a little bit, that provides that cosmetic and that functional piece to it through using the fish skin. I want to get into show you some of the slides and pictures that you can see, some of the clinical outcomes. So go ahead and slide. Keep going. We have a ton of data, so enough to put you to sleep. Right here, I like this slide. I just want to share a little bit. This is sort of how to apply the actual fish skin itself. So you have the pieces. We've designed it so that we actually have, you know, for the larger size fish skins here that are in these envelopes. You know, in the hospitals, we want to make sure that we're efficient with the size and the area so that we're not taking up too much space. So we have this on display here, and then the tech, after we end up, you know, we open the first piece here. The second piece will be inside here. This is where the tech will go ahead and provide it to, the circulating nurse will provide it to the tech, and then the tech will have it. They'll put it into room temperature saline, not to be misconstrued with warm. It could curl up otherwise, but you just lay it in here. It's fine if it sits there for longer periods, but just a minimum of 30 to a minute is what we want. And our motto is really that we need to make it bleed to seed. That's the important. It's not just laying it and saying, okay, you're good to go. So I really want to reiterate that it's very, very, very important that we want to make sure that we want to have the bleeding. The bleeding is what really creates that seeding. So we want to make it bleed to seed, okay? So first is we want to do a good debridement depending on the environment, of course. So in a wound setting, yes, it's going to be with debriding, okay? But in an OR case for a dehiscence or something that opens up or whatever it may be, you don't need to debride it. There's obviously plenty of blood there, so you can lay it on that particular structure or anatomical area that you're wanting to focus on for regenerating the tissue. Next step obviously is that you're going to go ahead. It's better to cut it before you end up wetting it. When you wet it, it can be a little bit challenging or cumbersome, but it's also good just to, you know, and when you're ready, the step 2 is just to put it into the water, the saline water, let it sit there 30 seconds to a minute, and then after you're done, you want to place this into whatever that area, again, if it will say it's a wound, you place it into the wound, and then after it's been placed, what you're going to do is get a couple, and again, a wound type setting, is that you want to go ahead and get an adaptic dressing, and then have it steri-stripped, and then putting kind of gauze or something over it. And typically in a wound setting, we'll have that stay on for up to about 7 days. And then the patient will come back every week for reapplication. Does that make sense? So that's what's important. In a burn setting, for example, it's a completely different, it's all about the post-op care. So I thought I'd give you 2 vast different experiences. So I just shared with you about the wound setting. So now in the burn setting, what's going to take place is the patient's laying in a certain anatomical structure. We end up applying, usually it's going to be a meshed area because it'll apply for greater coverage. And again, it's physician's preference based off what that particular patient is experiencing. But we're also going to lay this down with scale side up, okay? Scale side up. And because of the epidermis and the dermis layer of the structure. So you end up laying it down, and as you lay it out there, after you lay down all the fish skin and the comfort level of what you're after, then what you're going to do is you're going to apply sort of like a veil of some sort that we call like a wedding veil, and that's what's going to lay right on top of that. And then we'll end up greasing it with you know, something that's like a Vaseline at a high level. And the reason for that is so that the fish skin does not dry out. So when you're dealing with a burn patient, and that heat and that potential could dry up the fish skin. So it's very, very important to apply some Vaseline or something on top of this with the veil, and that's what ends up keeping the fish skin sort of moist and active, so it doesn't dry up and turn more of like a dark brown blackish, okay? And then after that's done, then we'll go ahead and put sort of, again, like a gauze or something of that nature. And again, these are stapled typically for burn is what we'll see. Again, and then what happens is the patient goes up on the floor, and then pretty much within about 48 hours, again, doctor's hospital preference is we'll go ahead and we'll pull back the dressing, and we'll pull back that veil, and then we'll take a visual look to assess the environment to see how it's going. And then what we'll do is we'll get a new veil, we'll put again like some Vaseline, keep it moist, and then we'll reapply it, and then gauze over that as well, and then lay it down. Then after about 5 days or so with the patient, we'll come back and then we'll do a complete dressing change. High level, okay? So again, I'm keeping this high level. There's a lot of attention to details depending on that anatomical positioning and situation of that particular burn patient. But does that help give a little bit better of a visual in two different scenarios? So you have the wound setting that, again, you're going to go ahead and do a lot of debridement, making sure that there's a lot of blood supply, and then you're going to apply the Kerecis, you apply an adaptic, and then you have the steri strips, and then the gauze over it. Okay? Next slide.
Can I ask a quick question
Sure.
about that first? What is the, I know you said that like hair can grow through that. So what is the scarring look like after that opposed to
Yeah, it's a great question. So we have a minimal amount of scarring as well.
Okay.
So as a prime example, we have what we're doing now is, so for pacemakers, and some of your patients, maybe at the VA, or my mother, for example, has a pacemaker. And so what they'll do is they'll make a small little slit incision here, and they'll apply this device here that keeps your heart going and pumping. And so it slows down, it picks it up, and it helps, so it monitors and keeps a steady heart. And there's a pocket, if you will, sort of like a shirt pocket. In this particular piece, they put the pacemaker down here. What we're doing is we're putting a piece of 3x7 of a Surgibind with the fenestrated piece that's laying right over here, right under the suture line. And that's creating less scarring and potential for having, you don't have that much of a worse of a scar than you typically would have because of the incorporation aspect and the properties that are in that with the heat. It's a real wow factor. Yeah, so we're just starting that. Good question. Okay, again, I talked a little bit about the micro. The micro is really great. We're applying it all over for, crevices, some of the tunneling aspect, really tough. And the reason behind that is because there's not a lot of vascularization in the ankle aspect. So what do you do in these types of situations? And so again, what did I say our premises was really it's important. You want to make it bleed to seed, right? So we really have to do a great job of debridement in these areas so we can create the bleeding to have the healing. And these are really, really challenging areas to heal. But with Kerecis and reapplications, we can have great success with them. I mean, we're healing wounds that haven't been able to be healed in 14 months. We're doing them in a month and a half, 2 months. Now, I'm going to put an asterisk next to this. Let's also be clear that if they're diabetic, they're smokers, those are some areas that can hinder that healing behavior that comes with it. Next slide, please. Okay. So again, this is more of a colostomy that can show you a little bit about the before and after 3 months with the epithelialization piece. Next. So we do Mohs. So we're having great success now with Mohs procedures. And again, we're using our micro, a good part, for these small little deficits for the scalp as well, that we're just basically, again, we have to create that bleeding. So it's the scraping that's a little bit uncomfortable, but we're applying just a little bit of the blood into the micro and then just placing it for helping out for some of these challenging type of procedures. Next, please. So again, Surgiclose, this is more the surgical aspect of it that we're using for, which is going to be in the OR. Aside from the burn is Graft Guide, but our brand name here for the OR is Surgiclose. Okay. So next slide. This was a snake bite that was performed, and as you can see, it's the necrotic tissue and how the debridement, 3 weeks. This is the initial application, 1 week, 2 week, 3 week, and you can see here, you know, applying the Kerecis and exposed tendon here, and the evolution within 3 weeks. Next slide. Necrotizing fasciitis, this is another big case that we really help and do well with. And again, as you can see here, you have your pre-debridement here, there's some exposed tendon here, the bone, you have the first application, day 4, and if you can, thank you, that's day 30, and you can see the evolution after 4 months. Okay, next slide. Hydronitis case here where you have, again, this is just to show you some examples of the micro and how you have some of these deficits that we're able to fill it in. I helped another particular female that had done a pure structure that we can present for medical. There's other companies that don't have, that have to go through that regimated process and the bleaching that comes with it. We don't have that, so we're able to bypass a lot of that, so that we end up having the minimal processing, and then we're able to box it and ship it. So there's a significant cost reduction in that. Our most expensive graft would be roughly on average around 8,000, something like that. So again, there's also, you know, contracts and other pieces that are involved with that that make sure that we're staying competitive against the other competitors. Another competitor of ours would be around, for a large size, maybe 14, 16, and then might be applying 2 or 3 of these grafts to give you an idea.
Does insurance cover this?
Yeah, so insurance covers it, that's correct. We're not on every insurance company though, in the office and wound care space, so we're getting there. We're getting a lot of name recognition, but not everyone, but we are on some, yes.
Maybe I missed it. Was this more external, but you can't do internal treatments, like license of adhesions in the abdomen? Have you gone internally or just more external care?
Yeah, we are FDA 510K from head to toe, but we're also implantable. Is that what you're asking?
Yeah, let's see, preventing adhesions within the abdomen, so to speak. You were in that aspect too?
Yeah.
Oh, interesting.
So this is East LaFleur at night, and just sort of shows you again in summary about our offices and the sustainability of codfish. It's a predator, so you don't have anything else that's going after us. So we have that sustainability piece too about the fish. Yeah.
How are the fish collected? Is it like a fish farm, or do they literally go out and fish for the fish out in the ocean?
Yeah, there's a lot. It's a fishing dispensary, so they're going out and fishing for these codfish and bring them in, and then there's a big process in place that we have where we end up bringing the fish in, and we use these skins a lot, and that's how we sort of take that.
Is there a resource, like video of how you process that, maybe on YouTube?
There are some on YouTube. Yeah.
Or is it like a hidden secret you have?
Yeah. That concludes our presentation. I know we went a little bit over, but I want to try to give as little as a background as I could. And just in closing, now that you guys are in the school and you're moving on to in the hospital settings, if you will, but our specialties, just to review in closing, is we have orthopedics, we have plastics for any kind of the flaps, we're doing general surgery, so any of the necrotizing fasciitis, vascular, physician specialties that we're dealing with, so those are above and below the amputations, anything, you know, like the femoral popliteals, things like that. We're dealing with colorectals, so we're doing penile cysts. We're doing Mohs, so for those particular surgeons that want to bring it into the OR, but also in the office space. So again, trauma, so that's basically the umbrella covers all the different types of traumatic, you know, wounds or issues that may be happening there, and then obviously for burn. So, thank you very much.
Oh, thank you.